Shocking news from Los Angeles tonight. NBC News has confirmed pop superstar Michael Jackson is dead at the age of 50.
Joan Rivers, one of the giants of American comedy, has died in New York.
Heath Ledger was found dead today in an apartment here in New York City. He was just 28 years old.
In 2015 alone, the National Center for Injury Prevention and Control reported over 33,000 deaths due to opioid overdoses. Opioids are drugs generally prescribed for pain reduction, and in the past years, their use has skyrocketed. With this onset has come a 600% increase in overdose-related deaths, around 80% of the total deaths relating to opioids. Even worse, prescription opioids can then form a gateway to other drugs, arguably contributing to the heroin epidemic facing many depressed areas today, as heroin is cheaper than prescription opioids and therefore easier to continuously use. How is it then that opioid overdoses are so commonplace among both the rich and the poor? The answer lies in the fact that many of today's doctors fail to recognize the long-term consequences of this deadly prescription drug.
Aaron was a normal kid, just like any other, when he got his first opioid for an old sports injury. It was nothing major, just a back injury. He was 20 or 21 when he first started taking the pills. When being prescribed, his doctor was very upfront and clear to Aaron that opioids were highly addictive, but they still caught a grasp on Aaron. His parents first noticed that something was wrong when he was at St. Thomas University and his girlfriend said something was really different with Aaron. She stated, "He wasn't going to class. He hasn't even left his room." That was when his parents realized there was a problem. They later learned he had been doctor hopping and making up stories just to get pills. Shortly after, they heard that their son had tried heroin for the first time. He said, "That's all I can do to feel normal." Soon, he had lost his job and was sneaking liquor from his house. His parents put him into treatment. When Aaron's parents visited him, Aaron did not seem committed. His parents told him, "You can choose this life. We can't make you do this the way we want you to." That was the very last thing that Aaron's parents said to him. They found out later their son wanted to have one last big party. He went to Minneapolis and found some bad drugs. Aaron died the next morning.
Medical debates over the validity and use of modern pharmaceutical medicine and herbal remedies is a long and fluctuating debate that continues to maintain presence into today's society. Herbal medicine, also referred to as botanical medicine or phytomedicine, has been used ever since the dawn of humanity. The early nomads used plant roots, leaves, flowers, and seeds in the form of oils and herbs to treat their kin. Minor ailments were treated with what herbs were available, yet major ailments were seen as supernatural and undiagnosable. It wasn't until roughly 35 years ago that herbal medicine gained legitimacy. At this point, the Egyptians had published the Ebers Papyrus, a document outlining all known herbal ailments, and the Chinese were experimenting heavily with oil extracts from plants. Medicine became far less trivial around 400 BC when Hippocrates released the Hippocratic Oath, which outlines a code of ethics among doctors and the medicine production cycle as a whole. Thanks to Hippocrates, modern medicine is approached as a science rather than a mystery. That being said, it is clear why most modern physicians oppose the use of herbal medicine. Its practice is not verified and relies heavily on testimonials. In fact, some of the most credible testimonials oppose the use of alternative medicine. Steve Jobs, whose decision to use herbal teas rather than chemotherapy under the early stages of cancer development, regretted his decision just before death. The issue with herbal medicine, most doctors believe, is that its proponents are advocating for an outdated system, rather than applying traditional practices to modern medicine. It shouldn't come as a surprise to most that the life expectancy of an average US citizen rose from 48 to 79 in the past 100 years. It was in the 1820s that Louis Pasteur discovered bacteria, leading to ample advancements in the research and development of antibiotics. This discovery resulted in the cure of smallpox and yellow fever, two diseases that took the lives of many colonial Americans. If it were not for the Hippocratic Oath and subsequent scientific medical practices, modern medicine as we know it, which found its footing in the 1900s, would have never existed to save so many lives. According to Elizabeth Blackburn, a biologist at the University of California, modern medicine's high success rate is due, in large part, to the structured process that is followed in drug creation and prescription. Considering that prescription drugs act to alter human chemistry, the U.S. Food and Drug Administration requires extensive research and testing before a drug can be marketed. Once medical researchers synthesize a new medication, they first conduct several chemical trials in a lab. Next, the drug is tested on animals. If effective and safe, the drug goes through rigorous clinical trials and an extensive series of tests done by the FDA. Once synthesized, however, antibiotics lose their effectiveness with increased use. This is due, in large part, to the fact that bacteria evolved to overcome their targeted antibiotic. Moreover, new antibiotics have not been formulated since the year 1984 due to difficulties with drug-resistant gram-negative bacteria. Under these conditions, prescription drug medicine will lose its effectiveness over the coming years. Herbal medicine, on the other hand, is not synthesized in a lab, which is why it offers more sustainable healing properties. As a wild and natural product, herbal remedies can often be applied to a wide array of health problems. Moreover, some of these remedies have been in use for centuries without losing effectiveness. A key argumentative claim behind the use of herbal medicine is that it follows the ages-old Egyptian belief that the body is a system of canals and blockages. Naturopathic doctors, who are certified physicians in alternative medicine, take a holistic approach in diagnosing their patients. By this process, naturopathic doctors and their patients adopt a closer relationship. According to Stephen Novella, a highly respected Yale neurologist, lasting connections between doctor and patient can lead to long-term health benefits. Seeing the lasting effects of herbal medicine as a replacement to the reduction in antibiotic potency, the 1990s U.S. Congress created an Office of Alternative Medicine, known as the National Center for Complementary and Alternative Medicine, and offered a $50 million budget to the research of non-conventional medicine. Today, more than 15 million Americans use some form of herbal remedy or high-dose vitamin, and the role of herbal medicine in today's economy exceeds $34 billion. While popular culture tends to advertise herbal medicine as a purely safe and effective healing outlet, there is a dark side to the production process. Herbs are often poorly labeled or even mislabeled by overseas markets. In an Australian study, 26 herbal products imported from China were 92% contaminated with heavy metals, undeclared plants, or even pharmaceuticals. While society currently holds prescription drugs and herbal medicine against one another, many doctors believe in a future in which the two entities can coexist.
A lot of people think that there is this conflict almost. You have a choice. You have conventional medicine or you have alternative medicine. That is a false choice. The reality is what herbal medicine does well is not what conventional medicine does well. And what conventional medicine does well, for the most part, is not what herbal medicine does well. If we are talking about the health of the patient, then the two used together in an intelligent manner is actually an incredible win-win for the patient. So when you create a protocol for somebody, you do not have a standard protocol for cancer of one type or another. You have a protocol that's designed to be specific to the person you are treating.
The United States imports the majority of its herbs due to poor regulations by the FDA. The U.S. Food and Drug Administration labels herbs as a food, not as drugs. This creates a situation where there is very little economic incentive for scientific testing, and as a result, very little of it is done. Companies then promote results from herbs that were never proven to have the desired effects, and in fact, most of them do not. Regardless of the form of medication taken, this debate also points to the importance of personal responsibility in medicine. Harm generally comes when people take medication of either form without questioning the potential consequences. It just may be worth some research to prevent becoming the next victim of current medical practices.